Polycystic ovarian syndrome. It is the most common hormonal problem in women of reproductive age group worldwide, and usually these women ranging between age 15 to 49. Risk and associated factors. Genetics. They found that if a woman has a PCOS, more likely her twin sister will have polycystic ovarian syndrome. Also, another factor for polycystic ovarian syndrome is environmental influences like diet. Number 3 is obesity, because as we know, obese women can have high estrogen in their body and can have associated hormonal imbalance. Polycystic ovarian syndrome patients usually, it's a syndrome because it's not a disease. Syndrome is group of things that can happen in a patient. The patient can present it with one problem or two or all or some of them. This is why it is called syndrome. So when we say syndrome, does not mean that the patient has everything or all the clinical pictures. She can have one problem or two or all of them. Now, polycystic ovarian syndrome patients can be presented with, number 1, very important and very common, menstrual irregularities and chronic anovulation, meaning the patient can be presented with lack of period for a month or two or several months. When the patient doesn't have a period or the woman doesn't have a period, usually she does not ovulate. Second group of patients usually presented with hyperandrogenism or high androgen in their body. Androgen means male hormone, testosterone. When these women have high androgen in their body, usually they presented with acne, hirsutism, meaning increased in their body hair, or alopecia, means losing hair pattern like male. So as we see, the patient can be presented with menstrual irregularities and or hyperandrogenism and or polycystic ovaries. So when these type of patients have transvaginal ultrasound, you see their ovaries having multiple follicles. Usually the young woman has some follicles in the ovary in the developing stage. In polycystic ovarian syndrome patients, they have multiple. Another associated manifestation with polycystic ovarian syndrome is some group of patients can be overweight or obese, but we don't want to be deceived with this manifestation, because some polycystic ovarian syndrome can be underweight or normal weight, but also it happens in overweight and obese patients. So very important in polycystic ovarian syndrome patients that they present with a period problem, like lack of period for several months or no period, no ovulation, and therefore usually they having problem getting pregnant, high androgens in the body, so they can be presented with acne, high body hair, increased body hair, or alopecia. And when they have transvaginal ultrasound, you see multiple follicles. Group of patients of polycystic ovarian syndrome, they are obese or overweight, and we will know why later on. As we said earlier, these polycystic ovarian syndrome patients, they have irregular periods, therefore they do not ovulate, and therefore they're not going to get pregnant. So if these patients trying to get pregnant, or these patients trying to get pregnant in a month or 2 or 3 while they having period irregularity, they gonna have difficulty getting pregnant. Very important in polycystic ovarian syndrome patients to check the insulin level because group of patients they have insulin resistance. So not all polycystic ovarian syndrome patients have insulin resistance, but some of them. When they do have insulin resistance, these patients usually they produce a lot of insulin to consume the carbs that they consume in their diet. And when they produce high insulin, insulin is anabolic hormone, meaning it helps them to gain weight. Therefore, these patients are overweight or obese or having a problem losing weight despite several types of diet, and they're usually frustrated, but that's because their body insulin is high. And insulin, when it is high in the woman's body, it acts like male hormone. So it helps them to gain weight. But also it works on the ovary and help the women's ovary to produce a lot of androgens. So therefore, the testosterone is high. So when the testosterone is high in the woman's body, it causes menstrual irregularities and the patient does not ovulate. Therefore, she will have problem getting pregnant. Also, with high androgens and high insulin, or because of menstrual irregularities, when we look into the reason why these patients have this problem with the period, as we said, because of imbalance in the hormone. So therefore, their estrogen is relatively higher than progesterone. So therefore, when they do not ovulate, it will continue to grow and grow and grow, and at the end, it ends up by cancer. But that does not happen over a month or two. So therefore, I don't want the patients with polycystic ovarian syndrome to be scared when they hear that. But estrogen production is high. It will stimulate the lining of the uterus to grow over 2, 3, 4 months because these patients don't have a period, so they don't shed the lining. Over several years, the lining of the uterus grow out of control and develop something called hyperplasia, which is a risk factor for endometrial cancer or they develop endometrial cancer. How do we deal with patients with polycystic ovarian syndrome? When we suspect about polycystic ovarian syndrome, we usually do some blood work. But first of all, when these patients usually presented with lack of period, we want to exclude pregnancy because, as we said, these patients are in the reproductive age group. So very, very common for young women to get pregnant. So the first thing when they present with lack of period, to rule out pregnancy. Also, very, very important, we need to rule out thyroid problems, meaning hyperactive or hypoactive thyroid gland, because problems with the thyroid can be presented with irregularities in the period. Number 3, we need to make sure that these patients have normal level of prolactin, because prolactin hormone can cause irregularities in the period or mess up the women's period. So therefore, we need to exclude pregnancy, we need to exclude thyroid problem, we need to exclude prolactin abnormalities. So we did the thyroid, we did the prolactin, and excluded pregnancy. Now, most of these hormones are going to be specific for the polycystic ovarian syndrome. Very, very important LH-FSH ratio. In polycystic ovarian syndrome, there is reversed ratio. We call it reversed ratio between LH and FSH. These are two hormones that we check, and there is a special ratio. Usually LH is lower than FSH. But in polycystic ovarian syndrome, LH is higher than FSH. And this is why the ratio reversed. Very, very important for any polycystic ovarian syndrome woman to ask or to check her levels to see the ratio, or to check her provider. Number 2, we check the estradiol or estrogen level. Usually it's higher than normal. The progesterone level usually lower than normal. Insulin level is high in patients with insulin resistance. So it can be normal in polycystic ovarian syndrome patients who do not have insulin resistance. Now, as we said, these patients usually consume a lot of carbs, so hemoglobin A1C is very helpful to track the sugar level in their blood. Now, also we need to check testosterone, that we call it the total and the free, the active form, because testosterone can be high in polycystic ovarian syndrome patients who have high androgen, or they presented with hirsutism, acne, or alopecia. We need to check this testosterone level. Along with the blood work, as we said earlier, we do the ultrasound, and the ultrasound is, when you do the transvaginal ultrasound, you see multiple follicles. So this is a typical picture for polycystic ovaries in polycystic ovarian syndrome patients. These black dots are called follicles. They are excessive of the normal. Usually in a young woman, when you do the transvaginal ultrasound, you see about 2 to 7 follicles at most in each ovary. When you see excessive pattern like that, that is characteristic for polycystic ovarian syndrome ultrasound picture. Very important, now we come to the conclusion of the management of polycystic ovarian syndrome patients, how we deal with them. Very important for the patients with polycystic ovarian syndrome to understand that treatment will be dependent on the patient's need. It is not one thing fit all. It's what the patient's needs are has to be fulfilled. For example, the diet and the exercise is going to be helpful for every type of polycystic ovarian syndrome patient. When I mean diet, not just losing weight, it's low calorie diet, meaning low carb diet, because these patients usually have a problem with the carbs and the insulin. So losing weight along with the exercise can normalize their hormones and therefore normalize their periods. So very, very important line of treatment for every polycystic ovarian syndrome is to have good, healthy lifestyle, diet and exercise. Then we come back to different categories. As we said, it depends on the patient's needs. So if these patients are not planning to try to get pregnant or not planning to get pregnant, but they just need to normalize their period and regulate their periods, then oral contraceptive or birth control pills will be a very good choice for them because it will regulate their periods along with the diet and the exercise and treatment of underlying hormonal problem will fix their problem. Now, another group of patients, we said they have high insulin in their body, and we called it insulin resistance. These type of patients will benefit a lot from, as we said, low calorie diet, meaning low carb diet, and limit their calories along with the exercise. Also, very important medication that we use for these type of patients is called metformin. Metformin in patients with insulin resistance, what it does, it increases patients' sensitivity to their own insulin. So therefore, they don't have to produce a lot of insulin. So the insulin level will be dramatically low. When the insulin is high in the body, it's anabolic hormone, meaning it helps them to gain weight. It helps them to produce a lot of androgen from the ovaries. Androgens means male hormones. It increases their problems with the period, with ovulation, with their weight. So when the metformin is taken, it will lower their insulin production. Therefore, it decreases their weight. So therefore, patients will lose weight. Also, it decreases the stimulation of the ovarian production of male hormone. So therefore, if they suffer from increased body hair or acne, it will be dramatically improved. And also because their body androgens decreased or the male hormones decreased, the irregularities in their period will be improved. Just by doing the diet and metformin, this patient can have normal period and sometimes can ovulate on their own without any help. Another group of patients who have high androgen or male hormone in their body. Usually these patients have acne or increased body hair. The treatment will be tailored based on their needs. The treatment is to lower their androgen in their body, increase the male hormone in their body, and treating the acne, treating the hair. And there will be a separate video for treatment of patients with PCOS who have high androgen in their body. The last group of patients who are suffering from infertility or having problem getting pregnant. As we said, PCOS patients having menstrual irregularities and having anovulation, meaning they do not ovulate, or when they do ovulate, it's in unpredictable pattern. So how can we treat these patients? By helping to regulate their period, helping them to ovulate, and monitor the ovulation and timed intercourse. And there will be a separate video for treatment of infertility in polycystic ovarian syndrome patients. At the end, I would like to thank you.